Thank you for the opportunity to present the key highlights of the panel on smart screening presented by the 6th Annual Global Summit on Precision Diagnosis and Treatment of Prostate Cancer. This virtual event took place in September 2022. Annual Summit was established since 2016 by AdMeTech Foundation, a nonprofit organization leading national and international groundbreaking programs in prostate cancer research, medical education, public awareness, and advocacy. Grant Rounds in Urology has been serving as our media partner since 2019. Dr. Henrik van Pappel of Belgium pointed out that based on annual reduction of mortality, PSA screening emerged as the most successful screening program in the history of cancer. Dr. Andrew Vickers of Memorial Sloan Kettering highlighted the importance of a smart screening, maximizing benefits while reducing harms. Dr. Vickers also reviewed the value of the baseline PSA in men at midlife in reducing unnecessary screening and overdiagnosis. The importance of integrating PSA with novel validated liquid biomarkers and imaging such as MRI for improved patient selection for biopsies, and the disruptive impact of MRI on the current risk stratification based on the number of positive cores and the percentage of cores occupied by cancer. Consequently, we discussed the critical importance of novel quantitative approaches to risk assessment, such as, for example, multifactorial nomograms, taking into account information derived from liquid markers and imaging to avoid overdiagnosis and overtreatment. For non-invasive diagnostic evaluation, we have seen significant and rapid progress in both clinically accepted and emerging liquid biomarkers that have been shown to improve prediction of aggressive prostate cancer and selection of patients for biopsy compared to PSA screening alone. More recently, testing for germline mutations has been recommended for men with family history of aggressive prostate cancer. In imaging, MRI and related PIRAT scoring for risk assessment have become a new standard of care. Advanced ultrasound has an exciting potential, particularly when it will be integrated with MRI. We have also seen interesting data demonstrating a promising role of molecular imaging integrated with MRI prior to biopsy, but further research is needed. Our panel on smart screening reviewed major clinical trials demonstrating compelling data on integrating PSA with liquid biomarkers and imaging for improved diagnostic performance and selection of patients for biopsies. Many urologists leading large-scale clinical trials pointed out that given all the advances in imaging and liquid biomarkers, patient selection for biopsies based on PSA screening alone is coming to an end. Liquid biomarkers can be easily administered in any doctor's office, while high-quality MRI requires specialized clinical settings. Further, liquid biomarkers appear to have a higher negative predictive value in this patient population. Based on the presented data, we have seen clinical utility of liquid biomarkers prior to MRI. However, more research is needed on the sequence of testing. Dr. Peter Albers of Germany presented a PROBASE trial looking at baseline PSA in young men. It is a prospective multi-center trial with participation of 4 German academic centers and the total patient accrual of over 46,000 men, about equally divided between the study arm A for men who start PSA screening at 45 and study arm B for men starting screening at 50. So far, the study showed very low prevalence of prostate cancer at the age of 45, only 0.2%, and about 91% of men at this age have low-grade prostate cancer. Dr. McHugh and Dr. Ellis of England presented BARCODE 1 trial, studying the role of polygenic risk score, or PRS, in stratifying men for targeting screening and improving early detection of significant prostate cancer. The study offers MRI and biopsy to men with PRS in the top 10%, in addition to PSA monitoring. Almost 1,500 men were invited to join the study from 7 clinical practices, with the overall uptake of 26% showing feasibility of the community-based study. Out of 174 men enrolled, 42% had prostate cancer, and Gleason 3+4 or higher was found in 47% of the detected cancers. In summary, 16% of men in the top 10% of the PRS score had clinically significant disease. This study may define the role of genetic profiling in targeted screening. Dr. Hashim Ahmed of Imperial College London presented a prostagram trial in over 400 men, comparing MRI, PSA, and ultrasound. The study utilized PSA with threshold of 3 for biopsy, beta mode ultrasound with elastography, and fast biparametric MRI about 10-12 minutes without contrast or endorectal coil. BP MRI found more clinically significant prostate cancer than PSA alone or ultrasound. PSA threshold of 1 in combination with PIRATES 4-5 appears to be an optimal strategy for low biopsy rates while maintaining higher sensitivity for clinically significant disease, though further research is needed. Dr. Martin Eklund of Karolinska Institute, Sweden, reviewed a randomized clinical trial in over 12,000 men with PSA 3 or higher. He showed that when integrated Stockholm 3 test, which is primarily based on liquid markers, and MRI, can reduce unnecessary biopsies for benign disease by 78%, and for low-grade Gleason cancer by 69%. Further, he showed that when Stockholm test was used first, the utilization of MRI was decreased by 36%. Dr. Caroline Moore of University College London, England, described a reimagined study in 334 men and showed how MRI-based screening can improve detection of clinically significant disease. She highlighted the role of increased PSA density as a quantitative parameter in identifying aggressive prostate cancer in men with negative MRI. Dr. Preston Sprinkle of Yale showed that in most clinical studies, high-precision real-time microultrasound has diagnostic accuracy comparable to MRI. Randomized optimum trial is currently underway to confirm this finding and evaluate benefit of the microultrasound fusion with MRI. Dr. Lewis Emmett of Australia pointed out that based on past studies, we know that PET PSMA may improve differentiation of group grade 1 from group grade 2 disease. She led primary trial, which recruited 296 men, to study the role of the combined PSMA, PET, and MRI for early detection of clinically significant cancer. This study showed that with PSMA and MRI integration, negative predictive value improved from 72% to 91%, and sensitivity improved from 83% to 97%. No impact on specificity was seen, however. Further research is needed, including cost-effectiveness analysis. Summit 2022 was made possible by the state of Massachusetts, the Donohoe family, and our sponsors, including Telex, Amgen, and Philips, Blue Earth, Lantheus, Exosome, Siemens, AAA, Johnson, Focal One, Exact View, Profound, Canon Medical, 4K Score, MD Health, Veru Pharma, Avenda Health, and PH RMA, as well as our governing and management team. Please join us for the next summit taking place on September 21 to 23, 2023, virtually. You will learn about the cutting-edge clinical advances and take part in creating a roadmap for the future of precision care. Thank you for your attention.